Hi, it's the Nursing Professor. Welcome back to another episode of Fundamentals on Friday. Today, I want to talk about something that's really, really important, and that is delegation. It sounds so simple. It sounds like you're able to get that off of you, but the truth is this. The licensed nurse is always accountable for whatever goes down. So be very careful about what you do delegate. All right, so to determine what you can delegate, you need to know your regulations of your state. You need to know what the Nurse Practice Act says and be quite aware of that, because don't go and think that you can delegate something just because someone appears to be comfortable or competent in their skills, because again, you are responsible. So some things that you can delegate are things like this: ADLs. People have been trained on that. Vital signs. Very important when you delegate vital signs that you have that person come back and report right away to you what those vital signs were. Because frequently what happens is you'll learn that you had some abnormality 1-2 hours later that should have been taken care of right away. Ambulation, repositioning, specimen collection. This specimen collection is something very simple, only simple specimen collection, things like a finger stick, as long as they've been trained and determined to be competent on that. Clean catch urine, where they just take the container and they take it off to the lab. But anything invasive should not be delegated. I don't care if that person's in nursing school or not. Don't get comfortable with it. Do not get comfortable with it, because I'm going to tell you, anything that goes down is going to be your responsibility. So let me tell you this quick story of something that happened to me. It's been many years ago, but I was working as a nursing supervisor in a long-term care facility, and a person who had expressive aphasia, meaning that they understood what you were saying, but they could not talk. Well, that person, you could tell that she was in pain. So she had had a stroke before in the past, so she had some left-sided paralysis, and this is just how this still sticks to me to this day. So her arm was kind of like this, all right? And so she was holding it, she was rubbing it, clear that she was in pain. So I went up to see her, called the provider, got an order for an x-ray, person had the x-ray, and it was determined that that arm was broken. All right, so I'm the supervisor in the house. So I'm the RN in the house at the time. All right, so the arm was broken, long-term care facility, so you can only imagine how much accountability, liability that was associated with that. So when the investigation happened, because I was the supervisor on duty, I had to explain myself to the Board of Nursing. What would a prudent nurse do? And I'm gonna tell you, although I had years of experience at that time, I knew what I was doing. It was really kind of frightening to sit in front of a Board of Nursing and explain why you did what you did. Well, the truth was, I didn't do anything. I wasn't even there when this lady's arm got broken, but it was my duty to come in, assess, and go to the next steps, which I did, and I had to fully explain that. So when they actually investigated, what they found was this, is that the nursing assistant had put on the patient's clothing incorrectly. So we know if someone has an affected arm, that this is the arm that goes in first, because that way they don't have to struggle with it to get in. You remember that? All right, so this should have been the arm that went in first, and then the other arm that was unaffected could move, have more mobility, and go in second. All right, so they backtracked and they found that out. So this happened on night shift before I actually came in. So although that happened before I came in, it got reported on my shift. And so, of course, there was no violation, no trouble, or anything like that. But I'm bringing this to your attention because I still had to answer to the fact that the nursing assistant had put on the clothing incorrectly, which in this little old lady's arm actually did fracture the arm. And so be very, very careful about delegation and understanding your role in that person, the patient that is being taken care of, is your responsibility because you are the licensed healthcare provider. All right, so at the end of this, I actually have a next gen ed question. It's a matching question. And I really want you to take a few moments and answer it, because this is what you're going to see on the latest NCLEX. You're not going to see a total test of multiple choice. And When I watch many of these reviews, that's what I'm actually seeing. So it'll only take you 2-3 minutes in order to get through this. So please don't click off. Don't click off right now. All right. All right. So I really hope this helps. I hope you understand the importance of delegation. I hope you understand that it will definitely be on your NCLEX, because NCLEX is all about safety and safe practice in which we are responsible for providing our patients. So if you like this video, please like, share, and comment down below, because I can give you more of these. I can give you more of next gen ed questions, because this is what the way that I actually teach now. And this is one of the reasons why I think new nurses are not passing the NCLEX on the first round, because people are still teaching as though multiple choice is the only type of question that you're going to get. And truthfully, it is not. It requires a little more thinking than that. So don't click off. Here's the question. I'll see you next week. Bye for now.